Coronavirus infections in cats. The coronavirus infection in cats was first diagnosed in Nepal in the 1940s and was recognized as an important disease of cats by 1963. This disease, identified as a virus-like particle in microscopic settings by 1971, was proven by 1972 to exist in two different forms, dry and wet. Although 90% of cats develop antibodies to the coronavirus, it has been observed that between 5% to 10% of those infected develop FIP, feline infectious peritonitis. The coronavirus infection, which is common worldwide, poses a risk to cats of all ages. What is FIP disease? Feline infectious peritonitis, FIP, is a viral infectious disease that can affect all cat breeds. The disease is caused by a mutated form of the feline coronavirus and directly impacts the cat's immune system. This virus is different from the COVID-19 coronavirus found in humans. Feline coronavirus generally shows no clear symptoms other than diarrhea. In approximately 10% of cats infected with the enteric coronavirus, the viruses have been observed to multiply, mutate, and transform into FIP. This disease can cause advanced infections in the cat's kidneys, brain, chest, and abdominal cavity. FIP can be life-threatening in infected cats. The most critical factor in the development of FIP is the interaction between the cat's immune system and the virus in its body. It is very important to take early measures to prevent a progressive effect once a cat is diagnosed with FIP. Symptoms of FIP disease? FIP can exhibit various symptoms depending on the organ affected by the infection. The commonly observed symptoms of FIP include lethargy, poor nutrition, fever, drowsiness, continuous weight loss, eye problems, tearing, reduced vision, changes in eye color, breathing difficulties, nasal congestion, balance and walking difficulties, swelling due to fluid accumulation in the chest and abdominal cavity. Due to the variable nature of these symptoms, it is quite challenging to diagnose FIP based on clinical signs alone. Symptoms similar to those of FIP can also indicate other diseases. Types of FIP? FIP can manifest in cats in either dry or wet forms. In cats infected with this disease, symptoms of either or both types may be observed. Wet FIP causes fluid accumulation in the chest and abdominal cavities, leading to a bloated appearance. Fluid accumulation can also occur in the chest cavity, progressively impairing the cat's breathing. Wet FIP can damage blood vessels, leading to inflammation and the flow of fluid from the blood to the abdomen and chest areas. Symptoms of wet FIP tend to worsen over time. Dry FIP can cause inflammatory lesions and infections around the veins, limiting the cat's normal movement and potentially causing seizures. Commonly affected organs include the liver, brain, lungs, skin, kidneys, and eyes. Dry FIP symptoms may intermittently include fever, vomiting, weight loss, excessive thirst, excessive urination, and jaundice. How is FIP diagnosed in cats? Diagnosing FIP is challenging as no specific test has yet been developed, and similar symptoms can indicate many different diseases. The disease can be diagnosed through detailed physical examinations and tests conducted under the supervision of a veterinarian. The diagnostic process guided by a physician is as follows. Physical examination, checking for symptoms such as weight loss, fever, diarrhea, eye infections, shortness of breath, and imbalance. Medical history, evaluating the cat's previous medical conditions, past illnesses, and vaccinations. Blood test, analyzing protein levels in the blood, albumin/globulin ratios, and other blood parameters. In cats with FIP, globulin levels are high, while albumin levels are low. Antibody test, detecting antibodies produced in the blood to combat FIP. Fluid analysis, examining fluid samples from various parts of the body to look for evidence of FIP. Imaging, utilizing X-rays, ultrasound, or advanced imaging methods when FIP is suspected. An immunoperoxidase test may be applied to further examine white blood cells and confirm the diagnosis. How is FIP treated in cats? Although FIP has historically been considered an incurable disease, today's scientific studies have led to the development of antiviral drugs that show promising results in treating the disease, though they are still in the developmental phase. Treatment for FIP may include supportive care such as draining accumulated fluid and blood transfusions. Consulted veterinarians will determine the most appropriate treatment method based on the symptoms and overall health status of the cat. Is FIP transmissible from cats to humans? FIP is not a disease that can be transmitted from cats to humans. However, to avoid any risk associated with the transmission of coronavirus among cats, it is crucial to disinfect after coming into contact with an animal that has the disease. Is FIP transmissible from cat to cat? The ease of transmission of the coronavirus that causes FIP allows the virus to spread rapidly among cats. Although coronavirus is contagious, the disease typically arises when the virus mutates under conditions such as immune deficiency, stress, or various other diseases.